Schizophrenia is an uncommon mental disorder, but extremely mainstream. It is an incurable mental disorder that is passed down through genetics. It was discovered by Emil Kraepelin in 1887. Most people do not know that if caught early, you can slow it down but never completely stop the disease. It is a horrible disease that slowly but surely takes away practically everything that is someone. Now let me give you some symptoms. First, we have our positive symptoms, which are hallucinations, delusions, and disorganized speech. Then we have our negative symptoms, which are flat affect, loss of pleasure in everyday life, lack of ability to start or continue planned activities, and lacking in speech. Types of schizophrenia have more or less symptoms considering, but the types are catatonic, paranoid, disorganized, undifferentiated, and residual. Ways of helping these people are according to the biological model in medications such as antipsychotics. The most common form of schizophrenia is paranoid schizophrenia. This type would make the person have delusions of persecution, hallucinatory voices that threaten or give commands, and hallucinations of smell or taste. Another type is catatonic schizophrenia. In this type, the person hardly ever talks and just kind of lays there or stands there. One of the amazing things about this type is the fact that sometimes they will strike a pose and be there for minutes, hours, days, and weeks. But they have this kind of waxy flexibility to them, so you can move them if need be. You have disorganized schizophrenia, which is a less functioning type, along with a more disorganized speech and thought. While having less ability to function, it has less prominent delusions and hallucinations, if there is any to begin with. Undifferentiated is the lack of fully developed symptoms or specific enough symptoms to permit classification. At one point, they might show signs of one type, and then later show signs of another, while those previous signs never appear again. Lastly, you have residual schizophrenia, which would be showing prominent signs at one point while being hospitalized, and then the symptoms become less and less prominent. You might still show signs, but not as outstanding as before. Now let's go way back to the 1800s, to a little town in Germany, as we meet a guy named Dr. Emil Kraepelin, a psychiatrist. He helps anyone who had anything from Alzheimer's to schizophrenia. At the time, schizophrenia wasn't called this. It was called dementia praecox. Before Kraepelin, people who had this disorder were considered to be possessed. He stopped those people from doing horrible things to the ill-struck with this disorder, such as drilling holes into the skull to release evil spirits or doing exorcisms to release the demon inside them. The reason he called it dementia praecox was because of his time with young adults who had dementia, thus early dementia. Eugene Bleuler later came along and revised Dr. Kraepelin's work and renamed it schizophrenia, meaning split mind, so this disorder would not be misdiagnosed. The symptoms of schizophrenia are numerous, but are easy to explain. Positive symptoms are symptoms that are shown in every type of schizophrenia, or the most common ones. Hallucinations are seeing, feeling, tasting, smelling, or hearing something that isn't there. Delusions are a belief that one has the false sense of themselves. Some schizophrenic people have signs that they are truly a famous person or someone that has died in high authority. Disorganized speech is directly connected to disorganized thinking. Some can't make a complete sentence, while others can. Clanging, for example, is when a person gets stuck on a certain sound, like the fat cat sat while wearing a hat carrying a bag. Word salad is a little bit harder to explain. It's them making an incoherent sentence while thinking they have made a complete sentence. Blocking is when they can't have a complete thought because they just stop and can't recall having the conversation. The negative symptoms are the ones that only certain cases show and are not prevalent in all cases. Firstly, the most popular negative symptom is flat affect, which is a severe reduction in emotional expressiveness in schizophrenia. It's more common to be monotonous while talking. Loss of pleasure in everyday life. This consists of not enjoying things you once had pleasure in, like reading or anything of that sort. Inability to start or continue planned activities involves being late for things or just not showing up and having to work out every day and just stop. The last negative symptom I mentioned is lack of speech. It is more predominant in catatonic more than most. As I said in the introduction, there isn't many types of therapy. It's more based on the antipsychotics. The biological model believes that this treatment is the best for the patient because the cause is neurotransmitters and parts of the brain. Thus, the main way to treat this would be use a drug that reverse the effects of those transmitters. Most of the side effects of the drug make the patient drowsy, dizzy when moving positions, have blurry vision, or rigidity in motion. There have been little to none deaths with the antipsychotics that have been tested, while some being tested have killed. Lastly, the statistical data for schizophrenia and its prevalence. In the entire world, there are 51 million cases right now. In the US, the number is 2.2 million. Along with the schizophrenia, it cost us $63 million in health care and medication. More hospital beds in Canada are filled with people with schizophrenia than with any other disease. The risk of suicide in schizophrenia is 50 times greater. If you have an identical twin and your twin has schizophrenia, your likeliness just went up 50% of having it. 200,000 people with schizophrenia are homeless because of their inability. Lastly, 6% of the people with schizophrenia are in prison.